New technology is revolutionizing the treatment of prostate cancer. It makes early diagnosed disease an outpatient treatment for cure. You can have dinner at home with your family or eat in a restaurant and return to work within 1 week. This has been used abroad for over a decade and now refined is approved by the FDA. It is available to many who are currently treated with procedures that require hospitalization, have much longer recoveries, and can have complications. The video that follows is a very short version of this story. The total story is available on our website at HIFUOH.com. That's HIFUOH.com. Thank you for having interest and taking your time. You will learn a great deal about this amazing treatment. Prostate cancer is a very common event in a man, and we see this a lot. We're also going to introduce a concept that you may be familiar with. It's called insignificant cancer. And there is such a thing. There's two areas here that really are hand in glove. Way of treatment without the traditional invasiveness of the surgical scalpel. This is an MRI. There is an area here. So we're going to call that, just like you would call a target for your bow and arrow, a targeted biopsy. Show that the targeted biopsy demonstrated two things: a higher grade of malignancy, and it showed us where the malignancy was. If you can analyze using MRI, you can pick out what you need to look at. Not only that, you can be much more precise as you select the tissue. Index lesion. I was talking about significant cancer, and I mentioned insignificant cancer. Some of the things that it does are not very well regulated. For instance, new growth of cells will generate new blood. That's called angiogenesis. And then there's other circumstances where cells will have a certain life cycle and then die. But there's some cells that are in what we call an index lesion that do not go through that process, become the type of cell that continues to grow, dominates the prostate, and then can spread beyond the confines of the prostate. High intensity focused ultrasound. Let's put that in a way so that we can guide where this energy goes. And we now are putting energy into the prostate, and let's just say that's a bad spot in the prostate. Magnifying glass. And when the energy isn't focused, we could put our fingers right in the path of that energy, and it wasn't even warm. That is the principle that allows us to use ultrasound to be able to specifically identify a bad spot in the prostate, and we can destroy that bad spot. Now, if we do that, and we look carefully with the MRI, it may be we don't have to do anything else. And the thing that's unique about high-intensity focused ultrasound, or HIFU, is it's very precise. It doesn't damage the tissues around it. So you can go after the bad spot and leave the tissues that are not involved alone. This is what we do when we're doing high-intensity focused ultrasound. We decide where we're going to put the heat, and we put the heat into these respective areas. This is what I was showing you before that was the bad spot in the prostate. What we've done here is we have destroyed that area of the prostate and the blood supply to it. And that's why it's dark under this circumstance. This is 180 days later. This really hasn't changed. This has healed some, but there was a bad spot in a prostate cancer there that is there no longer. There's 700 patients in this, which means that the function was retained and cure. The continence, the sexual function, and the cure rates are all close to 100%. It's done as an outpatient procedure. These circumstances are absolutely accurate. You can eliminate disease. We don't alter the patient's ability to live successfully with the type of treatment that we've just talked about.